So my name's Kyle Bowman. I'm the training officer for Marion County Ambulance. We're going to go over use of the AED here and everything associated with it that is in the packaging. So this is going to be in a situation for potential cardiac arrest. So first we always teach the same as what CPR does, is that look, listen, feel, shout, and ask for help. Get 911 en route. Once you have determined the patient does have a pulse, you don't need the AED, but you can put it on kind of as a precursor. But we're looking for patients that do not have a pulse. So a couple things with this AED: you can lift the top off here. This actually serves as a little board you can put behind their shoulders to kind of elevate them a little bit if you need to, if they're not in a good anatomical position. So you can pop that off and use that way. Inside your AED, you're going to see basically a step-by-step. It's got them numbered off. So you start here, and it just moves you across in a circle. And it's going to literally voice command you on what to do. So it's going to say attach pads. It's going to say analyzing rhythm, do not touch patient. It's going to say whether a shock is or is not advised. It will charge automatically. When you're ready to shock, there's a little heart button here. It'll light up, and you can press that. You clear everybody from the patient, press that, shock them, and then continue on your CPR. So it literally steps you through everything you have to use, which is really nice. Start by turning it on, and it'll get you through everything. Your pads are already all pre-hooked and set up. You just have to rip the packaging open and apply the pads. And I brought a set here. These pads are a little bit different. They have a puck in the middle, and that puck will help us when we get there. We can pull the defibrillator pads off and put them on our monitor. It'll actually tell us how good of compressions we're doing. We're looking for that 100 to 120 compressions a minute, and at least 2 inches of depth in the chest with good recoil. That's what we're looking for. So here's kind of what the pads would look like. And on all pads, they're going to show you literally where they go on the body. So one goes on the right chest wall, one goes on the left side below kind of the rib area. So all you got to do is, again, follow the picture depictions of everything on here, and it will tell you what to do.
And what do you do if someone has a really hairy chest? Will the pad stick to that, or?
So with a hairy chest, you have a couple options. If you have a couple sets of pads, you can put a set of pads on and rip them off. Use them kind of like wax. Or what a lot of places will do is they'll buy some disposable razors, and they will put them in their pack. So you can pull out your disposable razor, shave the area, and go from there. If you don't shave the area, it may potentially defibrillate, but it will also burn their skin, burn all the hair, and we don't want that. So same goes if they're wet. If they're wet, sweaty, you want to grab a towel or something dry and wipe it off before we place our pads on. So that way we can get good contact and good defibrillation without further harming the patient potentially. So in your guys' pack as well, there's going to be a pediatric set here, in case you have a pediatric patient that is in need. We generally say don't use the pediatric set on adult patients unless that's all you have. It's better than nothing, but it's not gonna charge to the amount of joules that would be required for an adult patient. So it may or may not help. It's not gonna hurt. So if that's all you have, that's fine. Like I said, my recommendation: disposable razors in here. To help you with that. Chest, some people would even throw a small towel in there. So with these AEDs, what I would highly encourage everybody to do is first off, pull it out, open it up, look at it, just get familiar with it, understand how the batteries are changed. They're in here, they unscrew, and there's a battery that goes in here. I would suggest testing the battery about once a month. To make sure it doesn't need replaced. That's the big thing. It's no good to have an AED if it doesn't work properly and it's not ready to go. We're always available and right across the street if you guys have any questions related to it. We can order whatever you need and help you with all that stuff.
So do the batteries come charged? Are they charged now?
Yes. Okay. So the AED comes fully ready to go. Literally turn it on and go. So
and how often do you have to charge the battery?
So the batteries don't charge; they're just replaceable. They generally just depends on use. So if it gets used, that battery is probably going to need to be replaced. Otherwise, generally they say about 3 to 6 months. Sometimes they'll last longer than that. So the manufacturer, I think, recommends every 6 months to a year, replacing them no matter what. But I would, if you just check them monthly, it'll tell you, it'll show up a little check mark over here, green check mark when you turn it on. That will tell you everything's good to go. So if it shows up as a red X or a circle, red circle, that would mean that there's a malfunction somewhere within the monitor in the machine. So you'll need to have it looked at or PM'd. And you can send these back to Zoll. If you have any problems with them, send them back to Zoll, and Zoll will go through them with a fine-tooth comb and figure out what the problem is and either give you a new one or fix it. So they're great assets as well to get a hold of.
So we actually have to order a battery to keep.
I would suggest a backup battery
Yeah,
for it for sure.
okay.
So I don't think. Let me see if I
I'll
can
look in
get
there.
this
Don't, go ahead.
Do those batteries have long shelf life?
Technically, probably, but generally we say if they're over a year old, they should probably be replaced. Just because this is one thing out of everything that you don't want to malfunction when you need it, right? So it's the anything else I would say you generally got some time, but I wouldn't mess around too much with these. And as far as pads go, you can order extra pads. All the information's on there. You just call Zoll, tell them the lot number, and they'll literally send you whatever you want for pads. So that's essentially it. I mean, check for a pulse, apply your pads, follow the steps as it says. Call 911. It will literally analyze on its own. It'll say do not touch patient, analyzing rhythm, and it will tell you to shock or not to shock. If it says do not shock or no shock advised, just keep doing good CPR. That's super important. That's what's going to save lives. Good, high quality CPR and early defibrillation. So this is the first thing you grab when you got an unresponsive patient. Check their pulse, have somebody get the AED, and then start compressions, and that's going to be what saves lives. Especially, during the day, it's nice here. You'll have a ton of help right away. If cardiac arrest goes out, we'll be across the street. At night, it's a little bit of a drive to get, get here from our bases. So it's nice to know kind of how to do that. And this will all go in coordination with your AHA CPR certification. So everything that they teach you in that class follows the guidelines of using the AED. And all that fun stuff. So that's essentially it. If there's no other questions,
Thank you very much, Eric. Appreciate it.
Yep, no problem.
Thanks for coming over too.